Um, Trace, you really make all of us in Oregon so proud, and you said it so well. And I want to get into an area that I really hadn't heard about from you, and that is how serious this problem is of young people getting lost in the system, where they just don't get connected. And the figure you used is 80% of referrals from schools for mental health support just go nowhere, just get lost. How does this make students and young people feel when they just get lost in all of this red tape and bureaucracy?
That's a great question, Senator Wyden. And I want to clarify that that statistic was for my school. So I don't actually know the national figure, but I imagine, right, there's similar trends across the country.
That was for your school, right, Trace? Okay,
Yes.
good. Please go
Yeah.
ahead.
But I think, right, when we talk about access to care, right, there has to be a conversation about what happens next, right? What happens next? Who is going to provide the follow through care? And I think for a lot of teens who get to this point and initially have that first conversation, not being able to get those accesses afterwards is incredibly isolating and incredibly defeating. And I think it really highlights some of the failures of our mental health care system and things that need to be addressed because teens who need help should receive help, and that help should be meaningful and sustainable for as long as they may need it.
Okay. Sit tight, Trace. Dr. Hoover, that 80% figure is really show stopping. And my sense is whether it's 80 or 60 or something, we're just losing a lot of young people at a really crucial time. What ought to be done about that?
Totally agree. And I would agree with Trace that it's probably not just in his school. We're seeing these figures across the nation. So the bottom line is that getting care to kids in some of our traditional outpatient settings really is a challenge. So as you heard earlier, one of the first lines of action really is to bring services to where young people are in their schools. We know that every state and many districts within each state have examples of really effective school-based mental health care, right? So this includes expanding our school employed workforce, including our school psychologists, school social workers, and counselors, but also helping facilitate partnerships with community behavioral health provider organizations to bring their services into schools. School-based health centers are also an ideal model of providing this type of on-site care. So increasing support for school-based health centers is one avenue. We mentioned telehealth already. We know the expansion of telehealth offers incredible opportunity to expand reach of specialists, not just into rural settings, although that's critical, but also into our urban settings. We've been providing telehealth from our hospitals into Baltimore City schools for a number of years now. We heard from Ms. Zaborski on reasonable reimbursement. That is a critical way of getting services to schools and and to outpatient care and having providers there to receive students when they are referred. So those are some of the avenues.
Well, thank you both. And Trace, if ever there was an area, as you said, for the committee to work with young people, it's mobilizing, in your words, to make sure that we don't see as many of these referrals get lost in the system. It's just too important because those are young people who are getting lost. I want to ask you one other question, Trace, and that is, you and I talked about barriers to care. And clearly, stigma associated with mental health challenges is a big part of this. I saw this with my brother, who struggled with schizophrenia for years as I went off and played basketball and all kinds of things like that. And my concern is I keep hearing from people in the schools and students like yourself that the stigma has clearly gotten worse as a result of the pandemic, causing more young people to be isolated from each other, that there wasn't enough peer-to-peer contact and like. Can you give us your thoughts on that?
Of course, yeah. I mean, I think we definitely saw how the pandemic increased rates of loneliness, isolation, and other high acuity mental health struggles. Um, But I think really the most important takeaway from the pandemic in our response to the mental health care crisis is the fact that COVID-19 exacerbated disparities that were already there, right? We know that access to care was limited before COVID-19, and the pandemic only amplified those barriers. So if a teen's only way of receiving mental health support was with a school counselor, that relationship was no longer there, and they could no longer have that conversation about mental health, right? And that in and of itself is destigmatizing the stigma around mental health. Um, and I just want to bring up, right? Like if a teen feels like the only way they can express their emotions is through the barrel of a gun, what have we become as a society in our perception of mental health for young people? And we really need to talk about mental health. And I think that first starts with having this conversation and recognizing how COVID exacerbated already existing disparities.
Trace, we had high expectations for you this morning, and you went way over the bar. So thank you so much, and you're going to have a seat at the table as we go forward on these big issues. And thank you. Senator Crapo is next.